Your mics are muted. And also, if you can turn off your video, this way we would be able to save on some bandwidth and things will move along a lot easier. This program will be recorded and will be uploaded onto YouTube later on, so you will receive that link. And you will also receive a link for a survey probably tomorrow morning. And we do appreciate that feedback if you can take the time to do that. So we are recording, so we're good there. And I am now going to pass it over to Mr. Shannon Dietz. Along with myself, we'll also have Kim Perry will be keeping an eye on questions and things like that as we go forward. So Shannon, I'm going to stop sharing and it's going to be all yours. You're on mute, Shannon. Can't hear you. Nope. No, all right, well, but Shannon, can you hear me? Okay. Why don't you hop off, exit, and then come back on? Try that. All right, this is a first for us, folks. So hopefully we will work through the kinks. Knock on wood, we've been lucky the past 5 weeks we've been doing these. We haven't had any major audio issues. So we'll give him a minute or two to have him try getting back on, and then we will pick up from there.
Paul, can you hear me?
Yes, I can, loud and clear.
Ooh, okay.
You're sweating a little, huh?
A little bit. Okay, let's see. Howdy, everyone. My name is Shannon Dietz. I'm the county ag agent with Texas A&M AgriLife Extension here in Harris County. And if you give me one quick second, I'm gonna get our presentation going here. Sorry about the delay, everyone. Paul, can you still hear me?
Yes, you're loud and clear.
Okay. Does everybody see the screen?
I see your screen. Yes.
All right. Good deal. Okay, so welcome everyone. Glad to have you all here this evening. Already went over introductions. What I do have on the first slide is, I don't think I've ever shared with you before, but it is my email address, shannon.dietz@ag.tamu.edu. If you haven't ever followed us on Facebook before, feel free to join us on Facebook, facebook.com/Harris County ANR /. And we post a lot of postings there on updates for all various kinds of agriculture in and around the Southeast Texas area. So we would be glad to have you as a friend there. So we're going to go ahead and get started with our presentation tonight. I will let you know that we are continuing from the first session, like Paul said. This is Backyard Poultry Part 2. And this time we're going to be focusing on disease management and or your flock. And if you have a current flock, or if you might be thinking about one, though. So we have where we're going to kind of pick up from last time. We talked a little bit about management practices and biosecurity and different things like that. And then also a special guest we have tonight with us, Dr. Larry Finken. He is a specialist with the Texas Department of disease verification down in the Gonzales area. And he's going to be our guest presenter tonight. So unfortunately, you won't be, he's pre-recorded, so you won't be able to ask any questions of him live or after the presentation's over. But he will give an email address at the end, and you can also always email me, and we will be glad to get those questions along to him. I will let you know that during his presentation, there are several slides of actual, what he calls necropsy, bird necropsies. They're actually autopsies. So there will be some kind of graphic slides. So if you're not wanting to view some of those, be forewarned that some of those slides can be a little graphic. First thing we're going to talk about disease management with your flock and everything. And like I said, this is continuing on from the first one we touched a little bit about is one of the things that you're going to want to do is minimize contact between your birds and different types of things that they're going to come in interaction with in everyday sources or contact around your yard, whether you keep them as a free range flock in your garden or in your yard, or if you keep them in a cage or anything. One of the first things we want to talk about is manure. One of the things that I would recommend is if you're in a cage, if your flock is in a cage, I would have you actually put 2x4s down on the bottom of your cage floor, cover that with a fine mesh. That way the fecal matter can still drop through to the ground and the birds aren't coming in contact with it, but they're not coming in contact with the ground also, which can be a source of parasite and worms and so forth. Wild birds and rodents, you're going to want to keep those away. That's kind of a given. Those will bring in other diseases, other vectors, other chances for your flock to become infested with parasites and other things that you definitely don't want them to come in contact with. Some of the things that we're going to talk about this time is a concept called all in and all out. Some of the questions were last week or last month actually is introducing new birds into your flock. If it's okay to do it while you have some birds that are more mature, some birds that are younger. We recommend actually starting with a set of birds, whether or not it might be 5, 6, 7, 8, 9, 10, or whatever the number might be, and start those from chick or pullet or adult birds and carry those all the way through their production cycle, and don't introduce any new birds into it. If you want to keep a cycle of fresh birds on hand, what you would do is you could actually kind of screen off, if you had enough space, that you could just keep one set of birds that were in production, and you might have another set of birds that are separated from that but are nearby that are chicks and that you're raising to replace the older birds whenever they do go out of production. So that way you're going to always have a constant production of eggs and different things like that. So, but you definitely want to keep those separated. All right. Clean, disinfect everything. Out period of at least 14 days. Whenever you're getting rid of your current flock, you might want to, well, rule is that you would keep your space open for 14 days. And that would be to gives you time to disinfect, gives you time to clean the facilities really good. And it also gives time for if there's any bacteria or any other airborne diseases that might be floating around in the air or in their coop or something during that 14 days, it would give them a chance to kind of flush it out. All right. Texas Veterinary Medical Diagnostic Lab. That's the place that Dr. Finken, who is our guest speaker today, is the current director at in the Gonzales station. And you can see his number there. We also have 2 other stations in Texas, in College Station and in Center. And their numbers are listed there, and I can always get those numbers for you if you don't have a pen and paper nearby to do that this time. They can perform necropsies, which is, like I said, an autopsy for a fee, but you would check the website for more information, which is tvmdl.tamu.edu. And again, this presentation will be available on YouTube later that you can go back and view this information. We talked about a little bit about biosecurity measures last time. 3 main components: isolation, prevent contact with infected vectors. Vectors are things that can transmit disease. Traffic control, limit access to flock to reduce exposure. People in vehicles. So you're not going to want a lot of people coming in exposure with your flock. The more people that are that come into contact with them, they might bring, if they might have a cold, or if they might have a runny nose or a cough, or you never know what kind of things people can be carriers of or anything. And those, when you're handling your birds, you're actually transporting those diseases, those bacteria and everything to your birds. So you're going to want to make sure that you limit that. Sanitation, you're always going to disinfect anything that encounters your flock. A lot of times people don't think about equipment, your coops, your footwear, and clothing. So those are a couple of things that you might want to consider keeping close sanitation on. Couple more biosecurity suggestions. Avoid visiting the flock more than once per day. You're always going to shower and change clothes. Disinfect your shoes between visits. Shoes or boots or anything, if you have a dedicated pair of shoes or boots that you only wear in the coop at that one time, you might be able to keep those separate. It would be best if you didn't always change different shoes and everything, because you're coming in contact with stuff in the ground, your stuff coming in contact with fecal matter and different things like that. So one pair of shoes or boots would be required, or strongly suggested. Shoe covers, if you can find those, are handy to you. Use dedicated shoes and clothing, where we talked about before when you're checking on flock. Discourage the presence of wild birds. Wild birds are coming in. If you think about it, from all over the United States, you can't control where birds are coming in from. And when birds are coming in from all over the United States, they're bringing other diseases, pests, vectors, and things with them like that. So they're always going to be introducing that. So make sure you try and keep your flock free of wild birds as possible. Not recommended to keep waterfowl and chicken on the same premises. We're talking about ducks, geese, chickens, and everything like that. I would strongly suggest you just keep your chickens to themselves. Do not share equipment, coops, or old feed, and consider, again, the all-in, all-out style of management. All right, what we're going to do now is, hopefully this is going to work. Fingers are crossed. I'm going to introduce Dr. Larry Finken, and I apologize in advance, but his presentation might go a little long. I've tried to cut it down to the minimum, the bare minimum, but he does cover a lot of really great information here. And so, like I said, if you're not able to view the whole series of his talk, it will be posted on YouTube and everything, but I want to go ahead and get to it. That way you can get the most information from it as possible. Again, this is pre-recorded, so he is not live. We won't be able to ask questions of him or anything like that. So with that being said,
hopefully I've got control of the slides now.
Paul, are you able to hear?
I'm just going to briefly discuss
Good,
a number
Shannon.
of diseases
Okay.
that I get calls on. Excuse me. I get a number of different calls on various diseases, or I get necropsies submitted, and I deal with that. And I'm going to highlight the ones that are most common that I get, in addition to ones that are also important and you should know about. Being part of the Veterinary Diagnostic Lab, we're here primarily to support the veterinary industry and support the practitioners. However, if there is no one that's available, or they defer to send you to quote unquote A&M, we're glad to provide service directly to producers and raisers, and I do quite a bit of that, and I do enjoy it very much. It's a wonderful clientele that I deal with, and I really, really enjoy it. One other thing that I note is there's a useful website that was put out by Mississippi State Extension that's got a number of solutions and treatments on it that I find very useful to give to people. It's got both general information, it's got some holistic type information. It's got things of many, many years ago that seem to work, and it's a nice thing to use. It didn't advance.
Bear with us, guys. It's going
there
to
we
pick up a
go.
little bit.
I'm going to jump right into the diseases. And this is the one that I get the call on the most, mycoplasmosis. It's a call where I've got upper respiratory disease in my birds. They have coughing, they have nasal discharge, they have watery eyes. And a lot of times they'll get a secondary infection and their face will swell up, etc. Uncomplicated infections are usually not fatal. This is the most common cause of disease in backyard flocks in my experience. We have two tools here at the diagnostic lab to diagnose it. We have a polymerase chain reaction that detects the presence of the organism directly. We do that on swabs, similar to what they do for the coronavirus testing in people. It's the same type of test. We also do serology for antibodies of birds that have gone through the infection. We can detect their antibodies, and often we make a presumptive diagnosis that the clinical disease they just went through was due to mycoplasma. And being a pathologist by training, I like to utilize a number of pictures of diseases.
Dr. Finken, I'm sorry, I don't think you have control of the screen, so you may need to click on grab control again, or I can advance the slides for you if you need me to.
Okay, it says that I've got it. I've got control.
Okay.
So go ahead and go to the next slide.
Sorry about that.
That'll work just fine. This is a picture of what you see is a watery eye, and you see a little exudate of nasal exudate in the nares on the left side of the screen. This is very common. They may have gurgling. They may have other kinds of symptoms that are all upper respiratory. They look like they have a bad cold. Next slide. In turkeys, when they get this disease, it's bad. Their sinuses blow up like balloons and they fill up with exudate. And it's very devastating for the commercial poultry industry because they cannot live with this particular disease. In backyard flocks, once your birds get over it, it's not that big a deal. They're just carriers. Next slide. Fortunately, we have treatment. A couple of them that have claims, Food and Drug Administration claims for it. Thailand soluble is one that I recommend usually. We still can get that drug. You have to get it through a veterinarian, and the lincomycin, spectinomycin, LS50 also is approved. It's approved for chickens. The other one is approved for both chickens and turkeys. We do give that for 5 to 7 days, and it works very well. Go to the next, you've got the next slide. I include this. I don't see this very often, but it's a differential for our mycoplasma diagnosis. It's called infectious coryza, and many people call me and say, I think I have coryza from what I've been able to read, and they usually have mycoplasma. But this one is a bacteria where mycoplasma is a bacteria that doesn't have a cell wall. This one also gives you similar symptoms, but the main sign is a swollen sinus, not so much the watery eyes, not so much the nasal discharge. Again, this one's usually not fatal unless it gets a secondary bacterial infection like E. coli, which we term colibacillosis. This one we have to do a culture on the material from the sinus rather than a PCR test or a serology test. We do not have either of those tools for this one, but we can isolate this organism and make a diagnosis. Next slide. And this one looks similar, but you can see that very swollen sinus under the eye, the infraorbital sinus, infectious coryza. And if you open that up, or if you're able to look at that, it looks just like honey. It's thick, just like honey, and we can usually isolate the organism from it. If it gets complicated, you'll get abscesses in that sinus, and that's when you get a more poor prognosis. Again, the treatment is exactly the same. The two same drugs have the same treatment regimens for that disease. So if you got one or the other, it really doesn't matter. you have a treatment tool if you want to use it. Next slide. I'm including this one because of its importance to the overall industry and to the backyard producers. It's called infectious laryngotracheitis. It is a viral disease that is very severe in naive birds, where they will do coughing up blood and mucus. If it's more chronic in nature, it's just a thick mucus, and the birds get very, very ill, and they usually die of this disease all by itself. It doesn't need any help. And the one thing that's very important is, if I get a case of this, even if it's not suspected by the submitter, but I suspect it, I have to test for it. And if it's positive, I have to report it to the Texas Animal Health Commission. And when they get that information, they come visit you and they determine what you're going to do with the flock. And most times it is you're forced to depopulate the entire flock, unless you have good reasons that you can convince them that you shouldn't. We do have two tools. We have a PCR test, that polymerase chain reaction for this disease. And then I can also do microscopic examination of the lesions in the trachea. Next slide. You can see on the left, there's two tracheas opened up, and you can see the blood in the trachea, and birds often cough this out, and there's a little bit of inflammatory exudate holding that blood together in that top slide. Over on the right, you may not be able to perceive it very well, but there's a large clump of cells about just under the middle of the slide that's filled with nuclei of cells that contain viral inclusions that are characteristic of this disease. That's how I make my diagnosis, along with the PCR test. Again, the importance of that is we do not want that in the state of Texas. It has to be eliminated and kept out. It's not a foreign animal disease, but it's an endemic disease that we don't want. Now, those previous three diseases can often lead to a secondary disease called colibacillosis. It's caused by Escherichia coli, the most common cause of mortality in poultry. However, it's almost entirely secondary to some other disease or some other stressor. Birds just have that sick bird look. They're depressed, they're lethargic, they're moribund, they have ruffled feathers, or you might even find them acutely dead. And the lesions are fairly typical depending on the syndrome. There's a number of different syndromes in the way this can show itself in the bird. What we do is we culture it, and it's very, very easy to culture. You get high numbers of this out of the birds. And sometimes we get high mortality in very young chicks or poults right after placement from the hatchery. And the next slide should show that. On the left is a young poult or young chick that came out of a hatchery, and you can see right at the bottom there, there's a little button, a little scab. That's where the bacteria entered in the navel as the yolk was pulled into the coelomic cavity, and that bird was infected from the time it was hatched. And if you open it up, it's all full of infection, and you'll get it. Any bacteria can do it, but E. coli is one of the most common ones. The one on the right is the common colibacillosis lesion that we see, where you've got this, it's called fibrin, that stuff, that yellow sticky stuff there that just on the surface of the liver and around the surface of the heart. That's just full of bacteria, and these birds die of a massive, overwhelming bacterial infection. Again, we can culture it readily. We do have treatment. This is one that's easy to get a hold of. I still think you have to get it from a veterinarian. Just tetracycline, it's an old drug. They're never going to take this one away from us in the poultry industry. At least I don't think so, because we have much better drugs that are superior to this for the human population. And you can vary the dose depending on how concentrated you want, how bad your infection, and you can treat for 5 to 7 days. The one bad thing about this is there's a number of these organisms that are resistant to tetracycline, and it may or may not work, but it's the best thing we have for early intervention to try to stop an outbreak. Okay, I'm going to shift gears now, and I'm going to go to a disease called Marek's disease. This is the second most common call that I get, and it's probably the most common thing that I diagnose here because I'll get the necropsy of it. Marek's disease is a virus that induces both inflammation and neoplasia. It's actually a virus that can cause cancer. There are 3 serotypes. There's the virulent, there's the naturally avirulent, and then there's one that they isolated from turkeys years and years ago, which is also avirulent. We have made vaccines out of all 3 serotypes. We started with the serotype 3. We then went to a combination with the serotype 3 and serotype 2 as the Marek's disease got more resistant to our vaccine pressure that we gave to the poultry industry. And then we've actually got one where we've taken a virulent organism and made it relatively avirulent and use it as a vaccine, or we can combine that with the other serotype 2 or the serotype 3, or you can give all 3. This is mainly a commercial industry problem. It's not a backyard flock problem. I'm just kind of giving you this as background information. The one that we have available to us routinely that you can buy yourself is the serotype 3. Their original vaccine, and it works very well in backyard flocks if administered appropriately. The biggest problem with Marek's is that it's produced in feather follicle epithelium and shed and chicken dander. So birds are exposed very, very early in life. This virus can remain infected for years. It's everywhere. It's in the HEB, it's in Walmart, it's in everywhere, because anywhere that anybody has been around a chicken and walked through it, you get feather follicle dust on your shoes, and you cannot get rid of it. It's almost impossible to do. So this is the one thing that I recommend if you're going to vaccinate your birds for anything. I recommend Marek's disease vaccination. Next slide. Early on, about 4 months of age, you may see the inflammatory part of this disease. It causes nervous symptoms. Birds will limp, they'll get lame, they'll go down, they won't be able to walk, or they may show blindness, they may show drunken stupor, inability to walk, just a nervous type syndrome and nothing else. Usually the neoplasia starts after a year of age or older. I just had a bird in last week that was 4 years old that developed Marek's disease, but it had been fine up until probably a couple of months prior to the fact that it had died. All the recovered birds, they shed indefinitely. Vaccinated birds shed. Non-vaccinated birds also get infected, they shed, so it's everywhere. The only diagnostic tool I have is necropsy with histopathology confirmation. Next slide. Here's the classic presentation of the original Marek's disease. It's one where birds are in lateral recumbency. The one leg is extended backward, the other one is pulled up tight under it, and this bird is unable to walk. If you could stand him up, he might take one step and roll over because that's the most comfortable position because he has no control over one of his legs. And that's because the virus and the inflammation associated with the virus has gone into the nervous system in his legs or her legs and caused the inability of nerve stimuli to go up and down those nerves, and the bird shows this kind of symptom. Any kind of nervous symptom is, in that age of bird, is suspect. Now we go on to the neoplasia part of this disease, which can show up in any organ. It can show up in the liver, so the bird dies of liver failure. It can show up in the lungs, and the bird can actually die of failure to be able to oxygenate the blood, just asphyxiate. It can show up in the heart, and it can die of a heart attack. That liver is about 4 or 5 times bigger than it should be, and it should be all a mahogany color like the right side of it. Just that very tip is normal. Everything else, all that whitish discoloration and lumpy lookingness, that's all tumor. Next slide. Here's one where the liver, you can see it's a little more normal size, but you can see some faint white spots in it. That's Merrick's disease, but that great big thing to its left is the spleen, which should be about, it should be so small that you hardly, you wouldn't see it. That's about 10 to 20 times bigger than it should be, and that's all tumor. And this bird probably had, it can have tumors in the kidney, it can have it in the heart, anywhere in the intestine, in the pancreas, wherever it goes, it causes interference with function. Next slide. Fortunately, even you can vaccinate if you hatch your own birds. The industry vaccinates almost all commercial poultry. They rarely even, anything that's going to live longer than about 50 days is going to get vaccinated in this country. Occasionally, they'll skip vaccinating a broiler flock if it's going to go out in a short time. But they either vaccinate in ovo, which means they vaccinate in the egg at 18 days of incubation, which is quite a feat. I lived through the time of the development of that process, and it's actually a marvel of modern day poultry production. Or you can vaccinate a day of age, and many of them still do it that way because they just want the females. They don't want the males because the males don't lay eggs and they're not useful. You can buy an HVT, that serotype 3 vaccine, online, and you can reconstitute it and you can vaccinate your birds. The problem is the minimum dose is 1,000, and you may only need 30 or 40. The vaccine only lasts about 2 to 3 hours once it's reconstituted because it is live, but it will do a good job of protecting your birds if you get it into the birds within the first 2 or 3 days of life. The earlier, the better. That's important. That vaccine costs about $20, $15 to $20 is what I've seen recently. One last thought on Merrick's disease is, like I said, I get this call quite a bit, and oftentimes people want to know for sure. There's one other disease that looks like it when you look at the lesions in the body, the tumors. There's a disease called lymphoid leukosis. It's transmitted through the egg. It's part of the genetics of the bird and the bird line. And so some backyard producers or some of these fancy breeds may possibly have this in their line. Again, it's one of those things that you don't have to be all that concerned about, because with both Merrick's and lymphoid leukosis, if all the birds are infected, the vast majority of the time, the disease is never seen. You may have 10% total over the life of the flock will die of tumors, and the other 90% show it. They're asymptomatic and they die of something else. So Merrick's disease is not a death. It's not a death sentence necessarily. It's just something that we can prevent with vaccination. The third most common call that I get is fowl pox, and Dr. Sufal alluded to this in his presentation. Many birds have their own specific pox virus, so we don't have to worry about a lot of the other pox viruses infecting our poultry because they're not specific for that. And the vast majority of this is spread through transmission of biting insects, primarily mosquitoes. They serve as a mechanical vector and they inoculate the skin and spread the virus bird to bird. The disease can be mild to severe depending on the infection rate and where it is. If it's severe around the eyes or the nares, the birds can go blind and die. If it gets down into their mouth or into their trachea, they can suffocate from the proliferative lesions that it induces. The only diagnostic tools we have is, well, the clinical presentation, as I'll show you in the pictures, and necropsy, and I can confirm for sure on histopathology. There's your classical pox virus on the comb of a rooster. Little wart-like lesions. Those will eventually heal and fall off. They'll probably leave a small scar, but They're of no consequence to that bird other than they make him look kind of funny. But that's it. Next slide. This is when it's bad. When you got a bad outbreak of mosquitoes and they've got a lot of virus that they're carrying around, where the bird actually, this bird would go blind because it cannot open its eye to see. If you have a little lesion around the eyelid, a lot of times what you do is you keep that eye clean until that lesion heals and falls off and that eyelid returns to normal, because you don't want a compromised eyelid to allow bacterial infection to close that eye up and destroy that eye. That's the one thing that you can do. This is when it gets down in the mouth. You can see these large crusty lesions, raised slightly yellowish white. Those are all pox lesions, similar to the ones on the comb. It's just, this is how they look in the mouth. And then the next slide, this is when it's bad. This is when the birds asphyxiate. That's the opening of the trachea, the glottis, and the top slide, you can see there's raised lesions there. That bird couldn't breathe through that. That just was a mechanical block. And many times these birds are gaping or gasping for air before they die, because that lesion just gets too big for them to properly breathe. Next slide. Fortunately, this one we have a vaccine as well, and you can vaccinate in the face of an outbreak. If you start seeing pox lesions in your birds, you can order a vaccine online. Again, it's about $15 to $20. It's 1,000 doses. The same type of thing happens with as with Merrick's. You reconstitute it. You want to use it in 2 to 3 hours. I usually say vaccinate everybody, whether they've got lesions or not. It may help resolve the lesions quicker, but it's a stab inoculation. It looks like what you stick in the end of a corn cob with a handle and 2 prongs, and there's a little slit in the prongs that holds enough vaccine, so when you dip it in the vaccine and stab it through the wing web, or on a turkey, sometimes they use a thigh stick, because the turkey puts its head under its wing and it might actually get pox from the vaccine. Should get a small bumper scab within 7 to 10 days. It should resolve in 14 days or 3 weeks. And if you want to do it as preventative, you usually wait till they're 4 to 6 weeks old. Some people vaccinate very, very young if they've got a real problem, but then would reboost. But if you have an outbreak, you can vaccinate any age bird at any time. You just get the vaccine and vaccinate. Here's what that little applicator looks like. There's a diluent and the vaccine. Here's one that's called Poxine. There's other generic vaccines available. You may only be able to find it combined with avian encephalomyelitis virus. That's just fine. You just go ahead and use that. You vaccinate your birds for avian encephalomyelitis as well. It's not going to hurt them. That's a disease of very, very young birds that we vaccinate mamas for, so that they produce enough antibodies in the egg to prevent them from getting the disease. But again, same principle as with Merrick's disease. Those are my top 3 that I get called about, in addition to the other ones that I put in there. Now I'm going to shift gears and go to one that many people have heard of, and they often treat, and they've dealt with it, they know what they're doing, but it's coccidiosis. It's caused by a protozoan parasite, and they're all of the genus Eimeria is what we use. It's a fecal oral transmission. The life cycle is 4 to 6 days. The disease can be mild, it can be moderate, it can be severe, depending on which coccidia you have and how big the dose is when they get infected. The bigger the dose, the worse disease. It usually appears at about 3 weeks of age or older is when you usually first see it. Then there's another one that shows up usually around 6 to 8 weeks, because it takes a little longer for it to develop. And there's two species that are pretty pathogenic or highly pathogenic. The others are less so. Another concern we have is we can get secondary bacterial infections from the genus Clostridium that can cause necrotic enteritis. My diagnostic tools, I can do necropsy. When I get them in and I'm looking for it, I do necropsy and scrape the areas that I think are affected. I can do histopathology on fixed tissues, and I can do a fecal flotation. And that's what often many clinics do. They'll just take some feces and see if they find the organisms in the fecal flotation. Next slide. Again, being a pathologist and liking pictures, this is Eimeria acervulina. This is the one that shows up in the upper part of the intestine. That is the pancreas with the duodenum wrapping around it. And all those little white things showing through the surface are large collections of coccidia. This one looks bad, but even with severe infestations of this, it's usually not fatal. The birds won't perform as well, but it's the lesser of the evil of the three that I'm going to show you. Next slide. This one is from the mids part of the intestine. This is in the jejunum part of the intestine. It's called Eimeria necatrix. And this one shows up as a very ballooning portion of the intestine, and the wall of the intestine is severely inflamed, and all that little, we call it a salt and pepper look to the outside of the intestine, has lots and lots of organisms in the wall of the intestine. And the problem with this one is it goes deeper into the wall of the intestine than the first one that I showed you. The other one, they just slough off and the lesion heals. This one destroys part of the lining, and so the gut has a very difficult time healing. And in the case here, it was fatal. This bird could not survive this. Next one. And this is the one that most people are familiar with. It's the one where you'll actually get frank blood in the stool. You'll see bloody feces, and they say, oh, you got coccidia, and they treat, and they get better. This is the one. It's called Eimeria tenella. It's in the cecal pouches, which is the two blind pouches toward the end of the intestinal tract of the chicken. And you can see on the left, there's those two red-looking banana-shaped portions of the intestine. They're just filled with necrotic dead debris and blood. And on the right, you can see one of the three sections is open, and you can see all the blood there. And these birds actually will just exsanguinate through this severe lesion if it gets this bad. Next slide. Wonderfully, we've got a treatment that's readily available that most people have heard of, Amprolium. The most common one that I hear of around here is Corid, is the brand name that's used. And you can give it 8 fluid ounces per 50 gallons, or if you've got a really bad outbreak, you can double that. And you usually give that for 3 to 5 days, and then you can step it down for a low dose for an additional 1 to 2 weeks. There's no withdrawal period. It's approved. It stays in the gut. It's not absorbed. The other option that we have that's also approved in this country is sulfadimethoxine, which is called Albon. You may recognize that brand name. It's a concentrated solution, and you can give that here as 1 fluid ounce per 2 gallons of water for chickens, and 1 fluid ounce for 4 gallons of water for turkeys. That's because turkeys treat about twice as much as chickens. You can treat for about 6 days, and then the withdrawal period is 5 days. But again, it can be very efficacious. And many people can still get Amprolium in the feed, some of the medicated feeds that you can get at various feed stores. If they say it's medicated, it's most likely Amprolium. It could be tetracycline, but I think that's so remote now because of the FDA and the USDA regulations that have pulled all antibiotics out of feed. I think it's probably Amprolium when they say treated feed. Next slide. Moving on, staying in the gut, internal parasites. We have 4 primary intestinal parasites of chickens: roundworms, tapeworms, threadworms, cecal worms. Symptoms can be weight loss, diarrhea. You can see worms in the feces and segments in the feces. A very common complaint of a bad infestation is the birds are eating normally or even voraciously, but they fail to gain or lose weight. And going back to this list here, the bad ones here are the tapeworms the microscopic version, and the threadworms. Next slide. This is a really bad case of roundworms. Everybody can see this. The only roundworms are the least pathogenic of this bunch that I'm listing, but when you get this big a bunch, you can actually mechanically block the intestine and the bird can die of intestinal blockage. That's the risk with roundworms, other than the fact that they just steal feed from the bird. And something like this can't be tolerated. This is tapeworms. You can see the segmented tapeworms. The bigger ones, when I usually see them, are not very many, and they're not all that pathogenic because there's so few. When I have a real problem with this is when I see microscopically, you can't even see them grossly, but you scrape the area of the intestine that you're suspecting, and they're just loaded with these microscopic tapeworms that are actually robbing the bird of its nutrition, and the bird can actually starve to death while it's still eating because they're so infested. But they look like that, only very, very small under the microscope. Here's one of a case that I think was mine that I have on the TVMDL website. These are threadworms. And these are also the really nasty bugs that can rob your bird. They show up in the upper small intestine, they burrow in there, and they just eat up all of the nutrition from the bird and interfere with the bird's digestion and absorption of material, similar to those microscopic tapeworms. And I've had birds, again, it's been a flock problem. I've had a number of these cases where they died of threadworm infestation because it was so bad. Next. This is the last one. These are cecal worms. Remember that cecum that I showed you with the blood from the coccidia? This is the tip of one of those cecal pouches, and you can see on the left little worms through the wall because it's full of gas. And on the right, it's opened up and you can see these worms. They don't seem to cause a lot of problems, other than they have one really bad feature is they carry another protozoan called Histomonas meleagritis, which is the cause of histomoniasis, often termed blackhead disease, which causes a severe disease in the cecum and also in the liver. It's not one that I'm not going to cover because I rarely see it in backyard birds. But that's the reason why you'd like to get rid of all these worms, because they're just robbing your bird of all of its nutrition. Next. Fortunately, we've got some treatments. One, piperazine. The only thing it does is treat adult ascarids, which is the least concern that you have. It doesn't treat anything else. You have to treat repeatedly. So it has limited use, just getting rid of adult roundworms. And that's about it. The next one that I've got listed has been recently done, and it's packaged for the commercial industry, and that's why it's expensive. It comes in 1 liter and 1 gallon sizes, and those are I think they're I can't remember, hundreds of dollars to get some of this stuff, and you don't need very much. But it says it treats roundworms and cecal worms. It does treat threadworms as well. The tapeworms, it might have a little efficacy. That's one that I'm not even really going to go to because you have to go way off label to treat those worms if you have them. But this is just fenbendazole, and it's made in a special way so that it stays in suspension. If you take fenbendazole Safeguard normally and just put it in water and try to feed your birds, you'll notice that it all precipitates out. And you have to keep it stirred up. And this one does stay in suspension, and that's why they developed it. Next slide. Now I want to go to worming treatments in non-producing birds. That means that these birds are not going to be used for eggs or meat on a for sale basis. But you can take that same drug, fenbendazole, in the Safeguard 10% form, it's a goat wormer. And you can treat those worms. It's the same drug. It's just doesn't have a label for poultry, but it's the exact same drug. And I got this off that Mississippi State extension letter or extension site that I told you. He said you can make an ounce of this product in a cup of water and mix it with 15 to 20 pounds of feed and feed that for 3 consecutive days, however much feed you have to mix it with. And that will deliver enough fenbendazole to clear out your worms. But again, it's the same drug. Now here's another one that's for non-producing birds. It's ivermectin or any of the generic. I'm using the labeled name Ivomec because I just have that as information, but there's all kinds of generic ivermectins now. There's a injectable that you can administer orally, or there's a pour-on that you can put on like a spot on, like you do for your dog and cat for fleas. You just put it on the back of between their feathers, between their wings, what we would call shoulder blades on a mammal, and 1/10 of a mil per kilogram. So if you have a 4-pound bird, you've got 2/10 of a mil, and that's it. And it treats roundworms, threadworms, gapeworms, which I did not discuss because I've never seen a case of it. And it also gets many of the external parasites, which makes it a superior wormer and parasiticide. But it's not approved in poultry. And then here's the second generation of that. It's got the same dose, the pour-on aprenomectin. It's the second generation of ivermectin. And again, it treats the same thing. And in its target animals, which are cattle, there's no withdrawal period, which is nice. But again, for non-producing birds. And then there's a couple others that can be used that I've heard of being used that work very, very well. Albendazole or valbazen and levamisole are prohibited. I don't have the dosage regimens readily handy for that, but all those have the possibility of being used in your show birds or non-producing birds. And last but not least, I've got some external parasites that I think I can get through before 1 o'clock. Fleas, lice, and mites. And it's funny because yesterday I got a call from a guy that said, I got fleas. And I got a call 2 weeks ago and said, I've got fleas. And it's interesting because a lot of people, we thought we kind of got rid of them, but now with the resurgence of backyard flocks, I don't see fleas in the commercial birds. I've never seen them in commercial birds. I have seen lice and mites and all, but the fleas were there. And you can get visible parasites. The birds can act nervous or shaking their head, or they just don't feel good. You can tell they're nervous. And I've had severe infestations where the birds died. Next slide. If you can see this is a chicken. If you see that, what looks like little black projections off of its comb and around its eyes, those are stick-tight fleas. And they are stuck tight. It's hard to pull them off. Next slide. That's what a flea looks like. It's just like any other looking flea under the microscope. Boy, I hate those things. This set of birds also had lice, and you can have lice on the body, like down here. You can have it up around the head, and you can see the lice crawling there. You can actually see the nits on the feathers. Next slide. And that's what the body louse looked like under the microscope. And very typical looking louse. And then mites. Mites are usually the ones that we see around here are the small mites, and they're around the vent. And this looks like all that peppery looking thing are all those tiny little mites. And when you look at them, they just crawl just like the lice. They're just very, very fast, and they move very, very quickly. And I don't have a microscopic of that. What we can do with those, there's external parasite treatment. You can treat flocks and premises. Some people like to use sulfur dust bags for self-administration. You just put some dust You can just take a dust bag and slit it open or put it in some kind of container and the birds will self-dust themselves.
We're almost done,
Or you
everybody.
can apply it directly to the birds yourself, or you can put it into the litter. This is one of the compounds that the organic people use when they have lice problems. They just go out and put sulfur dust in their litter. Here's what I got from an expert when I said I've got a flea problem, which he knew was the most difficult to treat. He gave me 3 different types of compounds, or 2 organophosphates and 1 permethrin, that you can spray directly on the birds and on the premises. And he gave me a dosage, and I have a handout that I send to people if they need it, to treat, and it seems to work very, very well. Next slide. What you do is you just mix up a gallon and you can spray 1,000 birds at a fairly decent pressure so that you can penetrate their feathers, and you can treat the entire facility. And then you can go back and treat it again 14 days later to try and keep these parasites at bay. And you may possibly, if you're so inclined, you could also give them ivermectin at the same time. Now I was asked to address 3 treatments or preventatives of interest that I have no experience with. So I'm speaking on what I could find and what makes sense to me. Garlic is often used in place of antibiotics, and there is some efficacy has been demonstrated in the past. I think even Louis Pasteur way back said that garlic had some kind of efficacy as an antibiotic type thing. And there's 3 compounds there, allicin, and I don't know how to pronounce the second one, and then methyl allyl trisulfide. They have antibacterial or antiprotozoal activity. That's their claims. I just don't know how good they are or if they're good at all. I just don't have any experience, but those are the claims and they may work. Next slide. The next one, apple cider vinegar for water treatment. It contains acetic acid, and apple cider vinegar has the same pH as the proventriculus. So when you dilute it in water, and water's got a more neutral pH, that pH of that water is going to be higher than the proventriculus. So you're not really acidifying the true stomach, but you are acidifying the crop. And that may be what some people have said, that may be what's very, very beneficial in helping with the antibacterial activity of apple cider vinegar, that it helps keep back the bacterial load in the crop. And it does contain vitamins, minerals, trace elements, a lot of good stuff. And I like stuff made with vinegar, and I like the taste of vinegar. And so chickens might like the acidified water just because it tastes better. And there may be some beneficial effect. I don't have any experience with it. And the last one, diatomaceous earth. It's a powder that's made from marine phytoplankton. And it's mined and then it's ground to a fine powder. It's included in dust bags for external parasites, included in feed for internal parasites. It's a little dicey in that you're supposed to wear a respirator when handling because of the dust. Efficacy to me is claimed to be from, it kills these parasites by 1,000 cuts. These are very sharp, angled little pieces of dust that potentially cut the parasites to death. That might work on a dust, in the dust type thing, but if you feed it into the bird, it gets clumped with water and then it just kind of clumps together. So I'm wondering if it can have much of an effect internally, because it may just clump into a glob like oatmeal or porridge, but it may have some efficacy externally. That would make sense to me. Again, I don't have any experience. And so that's
All right, guys. So I apologize for taking so long of your evening this today, but I thought the information that Dr. Finken went over was really beneficial and useful to a lot of the backyard poultry producers in the area. Again, I tried to keep it as short as possible. I cut some spaces out that you didn't even notice, but he is a wealth of information and he can talk about this stuff forever. So you see his contact information there. Again, if you need this contact information, feel free to give me a call or email, shannon.dietz@ag.tamu.edu. And I can provide you his information, or if you need necropsies done of his presentation and so forth. So that kind of wraps up our presentation again tonight. Again, thank you for your time. I apologize we went over, but hopefully the information was very beneficial. Thank you to Dr. Martin Finken, Director of the Texas A&M Vet Medical Diagnostics Lab in Gonzales, and Dr. Craig Sufal, Associate Professor and Extension Specialist with Texas A&M AgriLife Extension Service in College Station. Paul, that is the end of my presentation, and I'm going to turn it back over to you if you have any questions.
Okay. I am not seeing any questions in the chat box. Does anyone have a question before we sign off? Okay, I am not seeing anything in the way of questions. So I want to thank you all for joining us. Next week, Ms. Kim Perry will be on talking about 10 herbs to grow in the Houston area. So with that being said, thank you for joining us and have a good evening.
Thank you, everyone.